This is the big warning sign that your cortisol is high. In this video, I'm going to tell you 7 visible signs on your body that indicate your cortisol is elevated. And the big warning sign, as an endocrinologist, that makes me think of high cortisol, elevated. This is a topic with a lot of misinformation here on the internet. And in this video, you'll learn more about cortisol with a hormone specialist. All right, so let's start with the 7 signs of high cortisol. The first sign on your body that may indicate elevated cortisol is what we call centripetal obesity. Centripetal. What does that mean? It's when the fatty tissue, the adipose tissue, is more concentrated in the trunk. So it has this characteristic where your arms and legs are thinner and the fat is concentrated in the trunk area. Also, with the presence of a hump, which is the accumulation of fat. Here, it's the accumulation of abdominal fat, and along with that, proximal muscle weakness. What does that mean? You have trouble hanging clothes on the clothesline. You have difficulty getting up from a chair, and in those muscles I mentioned, to do those movements. This is what's called proximal muscle weakness. This also happens when cortisol levels rise, so centripetal obesity with muscle weakness. The second sign in your body is an increase in bruising because it can cause changes in your skin. The skin can become thinner, and along with that, you might have changes in blood clotting because cortisol also plays a role in our coagulation. So these bruises can happen. You don't know where you bumped yourself. You can't make the connection. It's not like those bruises you get when you hit your leg on a chair, for example, and you end up with that purple mark, that bruise. Here, with high cortisol, I see this a lot. Patients don't know. They can't figure out where that injury or bruise came from. Sign number 3, and this one is really important, is stretch marks. But it's not just any kind of stretch mark. Here, I'm talking about purple stretch marks. These are the stretch marks you're seeing here. They're stretch marks with this kind of color. Publish, and they're bigger than 1 centimeter. There are other types of stretch marks, like the white ones, for example. Other conditions can cause those, but not high cortisol. High cortisol will cause this kind of change. And the fourth sign that could indicate high cortisol is swelling. Swelling in the legs and feet. This swelling it can happen in other parts of the body too, but that's less common. Usually, it starts in the legs and feet because of gravity, especially at the end of the day. Remember, there are other causes like heart-related issues, such as heart failure. Weak kidneys, kidney failure can also cause this swelling, as well as liver problems. But changes in cortisol levels can also cause this swelling. Change number 5, and this one ends up being more of a visible sign for the person themselves, not so much for others, is a change in the hormonal axis. An increase in cortisol can cause, for example, menstrual irregularities, so changes in menstruation. And in men, it can cause a reduction in testosterone, along with all the signs and symptoms that come with it. Low testosterone will cause these symptoms in men. In both men and women, this can lead to infertility. So often, since I also work with hormonal and reproductive issues as an endocrinologist, I see patients with menstrual changes and many men with reduced testosterone. With these signs and symptoms, there's also a major warning sign that I'll mention at the end of the video. And they've never checked for elevated cortisol. Sign number 6 is hair loss, increased oily skin, and acne. This can also happen when cortisol levels are high. And sign number 7, the last one I'll mention before talking about the major warning sign, is changes in sleep. When your cortisol is elevated, it can cause insomnia. But changes in sleep mean a shift in your usual sleep pattern here. There are other signs and symptoms I could mention here as well, like bone fragility. A person is more likely to have a fracture, for example, because elevated cortisol can change bone composition, even leading to osteoporosis. When you get bad news, when you're doing the dishes, for example, a lot of people get stressed out. When you're stuck in traffic, locked in your car, this increase in cortisol is temporary. It happens naturally, but your body is able to control it. For you to have these signs and symptoms, usually this production will be due to a tumor that produces either the hormone that controls it, ACTH, or the cortisol itself. This is one of the big differences, which is why there are so many myths about it. So, a stressful moment isn't going to cause purple stretch marks or all these other changes. And what is the major warning sign? What, as an endocrinologist, makes we think a hormonal change that will indicate high cortisol? These are metabolic changes that are hard to control. For example, elevated blood sugar levels, even with treatment, even when the person is doing everything right, it's hard to control these high blood sugar levels. Diabetes is hard to manage. High blood pressure, many times the person is taking 3 or 4 different kinds of medication. And even then, they still can't get their blood pressure down. Their blood pressure is always high. Changes in cholesterol, high cholesterol, along with diabetes, hard to control hypertension, and increased waist circumference. You saw that one of the signs, the first visible sign I mentioned, you know it, centripetal obesity can cause this increase in abdominal difference. So these are metabolic changes that, even when identified and treated correctly, are resistant to treatment. What does that mean? They don't respond well. That kind of treatment, along with the visible signs, is highly suggestive of increased cortisol and calls for further investigation. And it's important to remember here that to investigate high cortisol, it's not just about doing the test. There's a correct technique for testing cortisol, right? There's medication you have to take the night before so you can see what happens to your cortisol levels, okay? And then we also have a full diagnostic confirmation. Should I make a video about this? If you want a video just about diagnosing high cortisol, leave a comment below saying part 2 about cortisol along with the city you're from. I'm speaking from Porto Alegre. Write here which part of the world you're watching from and what rating you give this video. Did you know about the signs and symptoms of high cortisol? Let me know in the comments. Now, I'm going to leave a suggestion for you to watch. It's a video where I talked about prediabetes. Did you know that with prediabetes, you already have an increased cardiovascular risk? You don't even have a diabetes diagnosis yet, and you already have an increased risk of having a heart attack. So it's important to know the signs and symptoms even at this stage so you can improve your quality of life and your health. In this video, you'll find more about the signs and symptoms of prediabetes. Take care. See you next time.